Okay, so what are the maternal and child indicators? What do they refer to? Social, economic, educational status, and as well as community level. Those are important. Um, Here, I will not get any numbers, honestly. No, not from this slide. And then medical terminologies, what is women's health, maternal health, and so on. Maternal mortality, direct, indirect, the formulas, no numbers. I will not bring any calculations, just the formula itself. Okay, this is very important, extremely important. Social determinants of maternal health is very important. Like exactly those questions, I'm gonna bring those scenarios too, and you need just to choose what are the things that gonna affect the woman negatively. Okay, coming to here is just you understand this. Saudi Arabia, just understand that maternal mortality is becoming lower than before. Here we said only the first three causes for maternal mortality, which is number one, hemorrhage, and then we have the hypertension and indirect. No need to know about the others. Okay. Also, how can we prevent maternal mortality? All of those, I think. Number one barrier is poverty, and then the other causes. What are the solutions offered by WHO to reduce the maternal mortality and improve maternal health? First of all, to have antenatal care clinic as part of primary health care. What are the principles of antenatal care clinic? These also. They are all honesty. Primary, secondary maternal health. I will bring like a scenario. Should this woman go to a specialist, secondary care, or should she go to a primary health care or family physician? Then, what are the WHO recommendations on antenatal care for a positive pregnancy experience? As well, here the nutrition. Those are very important. Vitamin A, don't give vitamin A. We need, what are the supplements recommended? Okay, maternal assessment, tobacco, what is it associated with? Okay, the most important also or very important thing to ask the woman about is the domestic violence, because as we said before, women who are pregnant are more or at higher risk of having a domestic violence. Okay, how do we assess the fetus? Just like if I bring a picture like this, I will just ask you, is that what is it used for? Okay, to of course to hear the heartbeat of the fetus or the baby. This is an echo, also all ultrasound to recognize or to detect any malformations the baby might have. Okay, vaccinations are very important before pregnancy, after pregnancy. Before pregnancy, pay attention that life attenuated vaccinations cannot be given during pregnancy, cannot be given even like a year before the woman become pregnant. At least we need to give a 1 month for the woman after giving her the live attenuated, only live attenuated. Killed vaccine we can give even the pregnant woman, we can give her if we like have to, then we can give the killed vaccine or the inactivated vaccines. But live attenuated, no, we cannot give it during pregnancy, and we have to leave a 1 month period after vaccinating her with a live attenuated vaccines. Okay. طيب. Why do we give Tdap vaccine to a pregnant woman? Why do we give her? To protect who? The baby. Mainly to protect the baby for the first 2-3 months until he is able or we are able to give him the Tdap vaccine. طيب. Postnatal period also is important as well. Oh, okay. The birth control methods, you are not required to know the details about them. It's just if I'm gonna ask you, this is what is that used for instance, for woman who has given birth, What do we use this for? It's for birth control. Okay, what does birth control means, or what does family planning mean? Okay, so one of these family planning is, or what is the importance of family planning? What I mean, this is important. Okay, those only if I'm gonna bring, like I'm gonna bring pictures and I will just tell you what is that used for. Okay, what is the aim of that? Okay, also this same as this type. So this is the first part. Let's go into the second part. Okay, this definitions, you know, definitions is very easy. Again, the formulas are important. Okay, I'm not gonna bring any numbers from here, nothing, just for you, Yani. What else? Those two just need to understand the general idea of them. Child mortality is becoming less. Where it is, where do we still witness child mortality the highest? Where? In low income countries or in developing countries. Okay, this is very important. Again, this is important. What are the social determinants of neonatal health? Okay, medical leading causes of neonatal mortality. What are the leading causes? Like for instance, preterm. Preterm, what's the meaning of preterm? Before completed 37 weeks, completed. Okay, how can we like reduce the numbers of preterm birth? The measures, we need to educate all women, not only women who are at risk. All women should know about preterm birth. How can we protect the woman from having a baby with a preterm or a premature baby? Birth defects, what are the recommendations to reduce the percentage of congenital malformations? Those are recommended by WHO as well. Okay, spina bifida, what would have protect a woman from having a baby with a spina bifida? Okay, taking folic acid. And what, according to public health, what did they do in order actually to reduce the number of women who are having babies with spina bifida? Of course, this is essential to neonatal care. Those are important. Okay, what factors contributed to the reduction in IMRs? Yeah, important issues also. Sudden infant death syndrome. This is very important, very important. Okay. Do you know when is until when the baby is at risk of sudden infant death syndrome?
1 year.
Exactly. And the highest during the first 6 months. The first 6 months, 90% of children, if they die, unfortunately, it might be because of sudden infant death. Okay, so the highest period is within the first 6 months. But still the baby is at risk until 1 year. Okay, but the highest is until 6 months. The highest from birth to 6 months, not from 6 months to 1 year. Okay, the first 6 months is the highest. All right. طيب, the measures. This can be an SAQ. For instance, how can we prevent the SETs? All right. Okay. Yeah. Okay, I saw you. Yeah, very, very important. But SAQ will not come from it. Okay. Okay. طيب. Nutrition also. When do we how long is recommended for women to breastfeed her baby until the first 6 months? Okay. All right. Those are really important. Just yani to know about. Yeah, car seats are important. Those you're gonna have a question from them. Yes.
Like in this picture,
Yeah.
it's kind of confusing.
Yes,
There's
exactly.
Specific inventory and
Okay.
Can you say the name of the agency?
Okay. Okay. This one, like rear-facing car seat. It is used, as I said before, from birth until 2 years old. Nobody use it until 4 because the baby will be taller and heavier. He cannot sit in that rear. So it is until 2 years. Okay. Forward facing is until age 5. Okay, so if you're gonna have a picture, you just need to know until when the baby should recommended by CDC to sit in this car seat. After that, we have the booster. The booster is actually most probably until the baby is 9, or it can be 9 to 12. Okay, after 12, no, the baby has to sit at the rear back and not rear seat and not front seat, definitely with a seat belt on. Okay, طيب. So this is until 2, this is until 5, this is until or 9 to 12, and that's actually after 12. That's what you need to know. Okay, this is important. 10% of children, this is very important, of children and adolescents experience mental disorder based on WHO globally. Okay, the importance, what are the common mental issues in childhood? No need to know about 1 out of 6. Just I need you to know only the 10% of children. Okay. طيب. What else do we have? Of course, all of that is important as well. What are the public health initiatives to reduce the number of children who are suffering from mental health? And that's it. What are the other childhood issues? Tooth decay, child disability, and that's it. Any question until now? Perfect. طيب. We have the vaccines. Let's see the vaccines. Vaccines is all important. Okay, here you just need to know, I don't want you to know exactly that polio is the one only that there were reduced numbers of children with polio after having the vaccine. After having the vaccine, we have reduced numbers of the illness caused by the infection that the vaccine protect against or protect from. طيب. What happened in 2020? Vaccines in year 2020, you know that there were a decline in the number of children receiving life-saving vaccines. This is because of the disruptions in the delivery system. طيب. Oh, yeah. Now, where's... yeah, this is very important. Extremely important. What is public health? What is primary health care regarding vaccination? What do each one of them do? Okay, this is very important. You might have like a picture of this, and you need to know what does the primary health care, what is the role of primary health care in vaccination? What is the role of public health in vaccination? طيب. How many children? I think this one came in the midterm. So, خلاص. Okay. Immunity. What is immunity? What are the types of immunity? You might have like herd immunity, a picture or explanation about it. I will ask you about it. That's it. It's easy, herd immunity, like this one. Okay. How can be achieved herd immunity? If I ask you how is it achieved, what are you gonna answer?
Vaccinate the majority of the people.
90%.
So vaccination only
Even getting the virus.
and infection. Yes, exactly. I asked this in a previous SQs. All of them wrote vaccination only. Only vaccination. If we vaccinate and kept on explaining, I said, how can it be achieved? By vaccination. What is, if I write, for instance, justify or explain about your answer, yes, you may say vaccination by more than 80%, but infection needs to be more than 90% of the population. Okay, so it's achieved by 2 things. And by the way, there were like 2 marks. They should have know that I'm asking for 2 things. But anyways, again, the marks sometimes is a bit deceiving because sometimes I put more marks than the percentage. So like they're gonna divide it differently then. Okay. Type. Yes. Sorry? Vaccination and infection. If you infect the whole population, 90% of the population, you're gonna achieve a herd immunity. But of course, we don't do that. We don't leave the population for natural selection. No. Yes.
You have to say the percentage, right? Or can you just say
Yes, better. But we're lenient with inshallah, with the grading. Yani to me, if, something, don't leave a question empty. Right. Anything. Not anything that I don't like medicine, like last year. My parents, they forced me to go into medicine. I hate medicine. I don't want to answer this question. And no, please. Yeah, the story of your life, keep it for yourself. So no awkward. And I like this professor. I don't like this professor. والله العظيم. يعني some like awkward answers. Oh my God. I don't know. They are funny. They are wallah. Yeah, I was about to cry when I saw. I hate this professor. I like this one, and then he gives us a lot to study. Okay. والله. طيب. What else here? We are talking about vaccination. So this one, no need to know about it. Okay? Don't worry. But you need to know what is here. What is life attenuated? And then in part 2, there is a list of the life attenuated vaccines. You need to know about it. Okay, so what is life attenuated vaccines, or what are the life attenuated vaccines? Pros and cons. Okay, here, heterologous vaccine. What is heterologous vaccine? What's the meaning of it? It's in the note. By the way, study the notes. Okay.
Is the example important here?
Yes, BCG vaccine. It's not an example. It's the BCG vaccine. Okay, inactive vaccines as well. The definition, pros and cons, subunits of this also as well. mRNA, how does it work? Maybe you get the picture and like for instance, I will ask you what is that antigenic part, the protein, S protein, antigenic part of the vaccine. What is that mRNA vaccine? Yani, you will get exactly the same picture. I will not يعني اخترع من مخي. Don't worry. Okay, and the explanation, it's all here in the notes. Like exactly the same for this one. Components are important as well, and benefits in economic evaluation of vaccinations. يعني common knowledge, honestly, but you need to know it, of course. خلاص, this question. خلاص. طيب. Let's move on. هذه, this one. Okay, this one you did not study, I know, for for the midterm. Okay, this one I told you don't need to know about it because it's all explained down below. Okay, those you need to know. What are the life attenuated vaccines? What are the inactive vaccines and subunit vaccines? Okay. This is very important. طيب, here, for instance, you might get a picture, for instance, like this, and I will give you like a scenario. What might be the infection that the baby could have protected from if he has taken the vaccine? The vaccines, of course, you need to know the abbreviation. As I said, for the symptoms, there's something always in bold, and that is the key symptom of that infection. Okay, so because honestly most of the viruses, even bacteria, they always start like a flu-like symptoms: fever, abdominal pain, sore throat. All of them are the same, but there is something sometimes that characterize one infection from the another. طيب, I don't need you to know how many how many doses to have the complete vaccination, but not to know when to give them. The number of doses, yeah, you need to know it, but not exactly like to give it at birth or 1 to 2 months and 6 to 18 months. No need for that. Okay, so only you need to know to complete the vaccination, we need to give 3 doses when the child before 6 years. So what I wanted to know, what are the vaccinations to be given from birth to 6 years, but not in exact time. Okay, the recommended vaccinations between birth and 6 years. Okay, number 1 is hepatitis B vaccine. Then we have rotavirus. Rotavirus is a 3-dose vaccine. Okay, and how is it transmitted? Yani, like exactly like this. What does it cause? Diarrhea, fever, and vomiting. Watery diarrhea. Add it, please. Watery diarrhea, no blood. Rotavirus doesn't cause any blood in stool. Watery diarrhea. And why it is so like what we are concerned about rotavirus? Because it causes dehydration and imbalance, electrolytes imbalance. Okay, so rotavirus causes watery diarrhea, no blood, and also it might cause dehydration and electrolyte imbalance. Okay, the other vaccinations that we need to give from birth to 6 years are DTP. What does DTP stand for? Diphtheria, tetanus, pertussis. Okay, طيب. Here, this is the white patch, which is about what is diphtheria. Whooping cough or severe cough or whooping cough, it is pertussis. When do we need to give DTaP vaccine? Of course, before 6 years, and then another vaccination should be, or dose should be given for preteens between 11 to 12 years with every pregnancy, even if the woman got DTaP with the first pregnancy, every time she's pregnant, she needs to take DTaP. For adults as well. Okay, one of your friends sent me a question. It's a nice question, but I didn't want to go through details with you. You might hear a notice that it is DTaP, however, those are Tdap. It's exactly the same. It's just the difference that the doses, what we are focusing on. Like for children, we are focusing more into diphtheria. All right, so the diphtheria dose will be a bit more than the others. Okay, for Tdap, we are focusing here in tetanus. So the dose here is a bit more for tetanus. But I don't want you to know about details. Inshallah, in year 3, I will explain about that in details. Yeah.
Doctor, so we need to know about the DTaP, that's 5 doses. We need to know.
Exactly, 5 doses, and needs to be completed before 6 years. This is the initial vaccine. DTaP vaccine, the initial one, it's a 5 doses vaccine, need to be completed before 6 years. طيب. The others are all boosters. Pneumococcal bacteria. Pneumonia is the most common cause of bacterial pneumonia in children. If you have a child and came to your clinic and he is suffering from pneumonia, you will immediately think about the reason is the pneumococcal bacteria, and then you need to give the appropriate treatment for this. Okay, and the name of its vaccine, PCV13. طيب. And then we have Haemophilus, influenza type B, polio virus. Polio, we have the intramuscular inactivated polio vaccine. It's 4-dose vaccine. We have the OPV. It's a 3 to 4 doses as well. Oral, it's, as we said, live attenuated. The intramuscular is inactivated. Okay, what is the rare adverse event that is related to oral polio vaccine? It is this one. Type chickenpox. Chickenpox also, the symptoms that is the key feature of chickenpox is the vesicles, which is a fluid-filled blisters. If I'm gonna have a picture, it will be very like clear, or I'm gonna bring this exactly the same, because you can see here there are sacs filled with fluids. طيب. Again, MMR also we need to give them before 6 years. We have rubella, measles, mumps is the swollen salivary glands, rubella, swollen lymph nodes, spots like or spots that fade rapidly, like here. However, in measles, it's always associated with races before having the rash. Rash is usually flat red spots, like this one. Flat red spots, it's very, very red. It's bright red. But for the rubella, it's pinkish. And the rash does not cover the whole body. However, for the measles, the rash is more severe and it covers the whole body. You barely can see a clean skin if a baby has measles. Okay, and of course, it's much more serious than rubella. طيب. Hepatitis A, of course. Here, as I told you before, all what you need to know is what are the preteens vaccinations, 11 to 12, what are they are recommended to take, flu, DDaP, HPV, and meningococcal. Meningococcal to protect from meningitis. Okay, meningococcal, what is it called? CWY. Those are, or ACWY. This is actually the strains that might cause meningitis. طيب. HPV, this is important. Yeah, here you need to know. Vaccine to be given at age 9 to 14, and this is usually scheduled for 2 doses that given 6 to 12 months apart. For HPV, please know when are the doses needs to be given. And we have a campaign, by the way, in the Mail Library. I would recommend strongly to take the vaccination, because this year we included also, or we actually asked for the vaccine Gardasil 9, which also includes the strains that cause benign tumors, which is warts. So it has all the strains, whether the strains that cause the cervical cancer or the strains that cause the warts. So I really recommend you all to have the HPV vaccine, and it doesn't cause any like side effects other than soreness at the site of injection. Yes.
Where did you say that was?
HPV vaccine.
You told us to go to the main library.
Yeah, it's the Mayor Library, first floor, beside the facility, between the facility and in the ground floor. Sorry, not first floor, ground floor, between the facility and Students Affairs. There is like a small hall, and there is you're gonna see the booth why, and we are offering it for free, of course, the first dose, and now we are working with them to also provide us with the second dose as well. Okay. Yeah. طيب, what are the controversy about the HPV vaccine? For adults, what kind of vaccines do we need to give them? Pregnancy vaccination, again, what are the recommended vaccination during pregnancy? Adults who are 50 years and older as well, we need to know about shingles, that it's recommended for people who are 50 and above. Why it is recommended? Because shingles cause severe pain and also sometimes leaves a long or lifelong pain after even healing. Okay. For adults who are 65 and above, a pneumococcal vaccine is recommended as well. Okay, so pneumococcal is not recommended for people who are 50. It is recommended for people who are older, who are 65 and above. However, if they have chronic diseases like diabetes, hypertension, cardiac disease, we can give pneumococcal vaccine to younger adults, like at 50. We start at 50. This is shingles as well. What are the Hajj vaccination, recommended vaccination or required vaccination? The recommended but optional are these. طيب. So this is regarding vaccination. Any questions so far? طيب. Let's talk about healthful living. Mindful living is very easy, honestly. Quit smoking. Yeah. How many people around the world they are smokers? This is an important number. 1.3 billion people worldwide are smokers. Okay, key facts. Here, all right. Where do people, 80% also, or no need for like to know exactly the number, it's just where do people or most of people who are smokers live. Okay. طيب. Tobacco use contributes to poverty. How is that? It might be like an SAQ. Okay. طيب. Here, this is very important, very important. At what age usually people start smoking, and after that they become regular smoker? It is between 14 to 25. Okay. طيب. Oh, smoking. Is it a pandemic or epidemic, and why? We explain that smoking, it is an epidemic, and this is for the because of why it is an epidemic. Because actually the spread of epidemic, it's always about something like behavioral. It's not about infection, non-infectious, but pandemic is about infectious disease. Honestly, smoking should be considered as pandemic because it is worldwide, but it is an epidemic because it does not fit the criteria of pandemic. Pandemic, it's about infectious disease, okay? And usually it is rapid, it has a rapid spread, and it's explosive spread, and it is for short and acute period. However, the epidemic, it's an ongoing for decades, okay? And usually it is gradual, right? Okay. And here we can prevent it and by like raising awareness and so on. However, here we need to contain it or to vaccinate the people to prevent a pandemic. So it is about fitting the criteria of epidemic and pandemic. طيب, the risks of smoking, you will know that it's responsible for 85%. This is important. All cases of lung cancer. So 85% of lung cancer caused because of smoking. Second, smoke. Of course, no safe exposure level. Even for someone who is like exposed every day for 1 cigarette per day, he's still at risk of developing health problems. Type. Increased risk of lung cancer in non-smokers by 20 to 30%. This is important. 20 to 30, this is important. What is the risk for the non-smokers or the negative smokers to get lung cancer? It is 20 to 30%. Type. What are the chemicals on tobacco, vaping? That's all important. Addiction to smoking, what is it associated with? How can we recommend smoking cessation? And what is the most important step when somebody quits smoking is to prevent the relapse. This is the most important step. طيب. That came like an SAQ before. I don't remember when. It is important. طيب. Let's talk about promote healthy lifestyle. What I want you to know from these is this one, healthy eating plate. And what are the difference, or what is the difference between the old and new food pyramid? It's in the note. That's what I want you to know, only from those. Promoting healthy eating, this is all honestly common sense, and you just try to read it, understand it. Promoting physical activity also, you just need to read. How many steps are recommended every day? 7,000 to 10 steps to maintain our health. Okay, not to reduce weight. خلاص, that's it for. Do you have any lecture out there, or maybe the others ما بعرف. طيب, I'm gonna move on بسرعة. طيب, هذا again public health prevention, very important. Malnutrition. Oh, prevention, levels of prevention. You are required to know what are the level of preventions and the examples on them. We said every screening is secondary prevention. Any program, it's primary prevention. What is malnutrition? Malnutrition is this. Okay. 1 out of 3 in a 3 have malnutrition. Where is the... Yeah. This one is important also. What are the difference in undernutrition? SDG, which one is associated with zero hunger? Which number? You don't know, you don't want, of course, you are not required to know those. Only SDG 2. What is SDG 2? Okay, that's it. And what are the initiatives in order to achieve zero hunger in Saudi Arabia? All right. طيب. Undernutrition. Actions, what are action plan to reduce the mortality from nutrient or malnourished children? This is also important. What is RUTF? Of course, not the components. I'm not going to ask you how many chicken in the packet. No. Okay. طيب. Signs, of course, of undernutrition are important. By the way, if you have a baby who is severely malnourished, we need to put him inpatient, to admit him as an inpatient. Severely malnourished. He has muscle wasting, he has edema in his leg, he's lazy, not moving, not playing, inactive, all of that. But if somebody who is, yes, although he's underweight, like below the 3rd percentile or 5th percentile on the BMI growth curves. BMI growth curve are very important. Definitely, you remember how we can calculate, how we draw a line vertically, horizontally, and at the intersection, it is the where if the baby will decide what baby if obese and so on. Okay, great. Fine. So if you have someone who is underweight but still he's playful or he's okay, you see his parents are aware about the problem, then you can still give them maybe are ready to use food, give them, and they can treat their child at home or in the community base, and with a follow-up, continuous follow-up. طيب. Yeah, the difference between marasmus and kwashiorkor is important. Cycle of hunger, it starts actually with the family. It starts here actually with poor nutrition, then it continues. طيب. How we prevent malnutrition as well. Importance of breastfeeding. Challenges also as well. Okay, all of that is really important. HIV, how is it related to malnutrition, and how can we, if we improve HIV, the woman who has HIV, pregnant woman with HIV, we treat them, then we will have a better babies or a healthier babies. Okay, and what is the recommendation regarding the woman who is having HIV? Of course, to take the medication during pregnancy and after giving birth. To also the same recommendation for everyone, to breastfeed for 6 months exclusively, then to continue with the complementary food. After 1 year the baby can eat, to continue the breastfeeding until 2 years, but exclusively for 6 months. Okay, how is that valid? She has HIV, what about the baby? Maybe he will contract the HIV from his mother. If the mother is taking the medication, And also if the mother is what else? Yeah, if she's taking the medication, and also our concern is the baby might contract an infection from the environment. Okay, and those women who lives in poor rural areas, their children are more susceptible to the infections that is taken from the environment than the HIV itself. Okay, so breastfeeding will protect those children from having the infection from around. Okay, طيب. Obesity, overweight, BMIs, those you need to know about them. Statistics, how many adults 18 years old and above are 40% of adults are actually overweight. No need for this one. Saudi Arabia, what is the estimated prevalence of obesity? This is an important, 1/3 of the population. طيب. This is general idea, I don't want you to know it. But here it is more what are the risks or what are the cancers that is really related, strongly related to obesity, breast, endometrial, and colorectal cancer. Another important factor for obesity or that put a person at increased risk of health problems is the waist to hip ratio, and you need to know those numbers definitely. Okay, above 0.8 for females, and this is the children growth curves of BMI. Those are very important. I'm gonna give you like a 12 years old child, his BMI. You're not gonna calculate the BMI. I will give you the BMI. BMI, for instance, is 20, and this is the 20, and he is 12, for instance. And then you need to know whether he is obese. If he is above 85 percentile, he's overweight. If he is above 95 percentile, he is obese. If he is between 5 to 85, he is normal. Below 5, he is underweight. I'm gonna bring you something more clear than this one.
The curve is there already.
Yes, the curves are there
With the percentile?
with the percentile.
Can you repeat
Yeah.
the percentages?
Yeah, sure. Let me check. Okay. Yeah. For the percentile, if you have a 12 years old child, okay, he's 12, and his BMI is 20. Here's the 20. We draw a line vertically from here until we reach the 20. So this is 20, and we draw a line here horizontally. At the intersection, you will decide whether the baby is obese, overweight, underweight, normal weight. If the percentage fall here, percentile, it's here. Here, it is normal because it's around 50, between 5 and 85. Between 5 and 85, he is normal weight. Above 85, he is overweight. Above 95, he is obese. Under 5, he is underweight. Okay, understood? طيب. Okay, that's it. Oral health, I think it's all about, we're done. Yeah. Can you stay here for 10 minutes? Dr. Zaidi can come and
Yes.
okay,
Yes.
great.
I need this.
Your M1, M2. But I mean yeah. Yeah, but it is M1, M2 013, right?
Yes.
M2 013. Okay. Oral health across lifespan is very, what is the definition? It's very easy. Why it is important? Why oral health is important? Because actually it is among the most prevalent disease globally. So, and it can be prevented. Okay. طيب. What are the risk factors? Okay. Yeah, oral diseases are more common in disadvantaged population. Why is that? Okay. Oral health is SDOH. Vulnerable population, oral health. It's very easy.
Yeah.
Yeah, I'm gonna just talk about like tooth anatomy. You don't need, of course, to know about it, except for this one. It's the enamel is the hardest substance in the human body, and it's actually the white coat in the of the teeth. And then we have dental caries. How does caries happen? You might have a picture of this, or maybe an explanation. It's important to know about the name of the bacteria. Okay, that is involved in caries. Okay, no need for any like numbers here. All right, you might get a picture. Okay, just pictures, and I will ask you what is that. This is the damaged, brown cavitation is the damaged stage. Here is the initial stage or the early stage of caries, white spots. Okay, طيب, and this is the advanced caries. Periodontal diseases are important. You need to know, differentiate between gingivitis and periodontitis. Periodontitis is an advanced disease of the inflammation of the gum. Okay, and it is associated with bone loss and tooth attachment. Is there any? Oh my God. Okay, gingivitis. The causes of gingivitis is maybe associated with plaques or not plaque induced, maybe genetic or trauma related. It might be related to systemic factors, especially like medications, like hypertension medications, calcium channel blockers, immunosuppressant, phenytoin, as anti-seizure medications. Okay. طيب. Periodontitis, major risk. In a pregnancy as well. The oral cancer, what are the two precursors, the risk factors? Where is the most common location? Those are the precursors. How to prevent oral disease? This is what are the dental sealants? Fluoridation is very important. This is very important. 25%. Today, fluoridation prevents at least 25% of tooth decay. So this is important. The number here. طيب. Yeah, and this is maybe an SAQ. You never know. How does community water fluoridation ensures equity and equality? There is, that's the answers. خلاص, that's it. Yes. I'm done, but let me